Welcome to the Institute for Healthcare Advancement Health Literacy Conference, strengthening our health literacy efforts through insights, rejuvenation, and innovation. Our topic today for this pre-recorded conference is communication, education, and vaccination, health literacy, and how it impacts vaccine confidence. Three people have been the leading lights behind this project and this presentation: Ms. Amanda Aguirre, myself, Russ Bennett, and Mr. Hari Camino. And the project has been done for the Regional Center for Border Health in Western Arizona. First, I will give an overview of the project and the learning objectives. Starting with our introductions, Ms. Amanda Aguirre, MA and RD, is a former Arizona State Senator, and she presently serves in the capacity of President and CEO of the Regional Center for Border Health since 1991, and its subsidiary, the San Luis Walk-In Clinic, a primary care rural health medical center. She has been involved for more than 35 years in healthcare and business administration, and in 2007, she established a licensed post-secondary vocational training center in the area, the RCBH's College of Health Careers, which has generated job opportunities for over 1,800 individuals. She has built these corporations that have become really multi-million-dollar corporations, providing employment for over 380 employees in a slowly recovering economy. In 2003, Ms. Aguirre became the first female and first Hispanic to represent District 24, new Legislative District 4 in the Arizona House of Representatives, and subsequently in the Arizona State Senate in 2006 to 2010, where she had great success in passing key bipartisan legislation. And introducing myself, I'm Russ Bennett. I was born in the US, I lived in Mexico for 30 years and became fully bilingual in English and Spanish and bicultural. I was working in San Diego for many years and for Sharp Healthcare as Director of Multicultural and International Services. I spent 2 years at the beginning of the US-Mexico Border Health Commission for the Department of Health and Human Services as the founding executive, and then moved to United Healthcare, where I became Vice President and founder of Latino Health Solutions, and later Vice President of Strategy for Social Determinants of Health. I was there for a total of 16 years. I've been a consultant to IHA, the Institute for Healthcare Advancement, for about 4 years, and I've been a consultant to the Regional Center for Border Health in Arizona for 2 years. I'm now a member of the Patient Engagement Advisory Panel for PCORI, the Patient-Centered Outcomes Research Institute, and I've been a healthcare columnist in Spanish for Saludiario medical magazine that goes to Mexico and Latin America. Mr. Hari Camino is the founder and general manager of Satya Social Purpose Communication, an award-winning communications company based in Mexico City. He's received international recognition for his video design and production, promoting corporate social responsibility, and he's presented at health literacy conferences and webinars in Mexico and the US. For this project, he provided writing and storytelling services, as well as videography, video editing, market research, content strategy, marketing, and some PR, as well as awareness and training about health literacy in both Spanish and English. As a result of Mr. Camino's insight-based approach to the media channels, the companies and nonprofits he works with are building stronger strategies for successful community and employee engagement and increasing their business visibility through quality content marketing across digital and print platforms alike. Our learning objectives today are to identify the major myths that cause vaccine hesitancy in the border population, to summarize how these myths can be addressed with two distinct but related communication strategies, to explain why low health literacy fear and lack of trust have led to vaccine hesitancy, and to illustrate the differences between each of our target audiences and the media choices to reach each of them. Then, to outline the positive effects that the communication campaign had on vaccine confidence and uptake, and to discuss briefly the levels of vaccination in the target areas after the communication, education, and vaccination campaign. An article from the Kaiser Family Foundation in January of last year stated that the COVID-19 pandemic's impact has been felt in communities across the U.S., from the largest urban centers to the smallest rural communities. As previous research has demonstrated, rural communities face unique challenges in responding to the pandemic due to medical workforce shortages, fewer hospital beds per capita, limited access to telehealth, and populations that are at elevated risk for COVID-19 related deaths due to age or chronic disease prevalence. An analysis from the Pew Research Center found that sparsely populated rural areas were accounting for twice the number of coronavirus-related deaths as urban areas. In July of 2021, the Regional Center for Border Health received a HRSA grant to help increase vaccine confidence under the Rural Health Clinic Vaccine Confidence RHCVC program. The purpose of this program is to address COVID-19 related health equity and to improve healthcare in rural areas by engaging rural health clinics to improve vaccine confidence and counter vaccine hesitancy in rural communities. On behalf of Ms. Amanda Aguirre, President and CEO of the Regional Center for Border Health, I'd like to introduce the center and talk a little bit about the process that we followed in this project. The Regional Center for Border Health serves 3 counties in western Arizona with a total population of over 450,000 people. Yuma County has a population of 218,000. La Paz County, to the north of Yuma, has a population in excess of 21,000. And Mojave County, to the north of La Paz and bordering California, has a population of over 217,000. Now this is a large number of people, but we add another 40 to 50,000 people seasonally who are temporary agricultural workers and winter visitors. And in these 3 counties, we also have various Native American tribes. The combined geographic area is over 23,000 square miles. And there are different ethnic and socioeconomic profiles in each of the 3 counties. But all of them have high vulnerability. They have high Hispanic and Spanish preference population, although the highest Hispanic population is in Yuma. There's a highly mobile population, and it includes isolated and vaccine-resistant populations. The mission of RCBH is a commitment to improving the quality of life of the residents along the U.S.-Mexico border by increasing accessibility to quality training and affordable health care. And RCBH has been doing this and facilitating medical services for over 35 years. The Regional Center for Border Health also has created the San Luis Walk-in Clinic that now has 6 clinics, a staff of over 380 employees, and also other affiliates, which include the College of Health Careers, Capaz Mex, a medical discount network that works on both sides of the border in Arizona and Sonora, the Main Street Cafe, the Family Behavioral Integrated Health Services, and the Center for Children with Special Needs and Autism. Here's a photo of some of the key leaders with Ms. Aguirre in the center. And I'll talk a little bit about our process to get this program underway. First of all, we wanted to involve stakeholders and employees from the very beginning. Ms. Aguirre hired me and Mr. Camino as consultants with long-term border area and Hispanic segment experience. We had a kickoff meeting with the RCBH leaders, promotoras, and employees who have been with RCBH up to 20 years or more. And we worked then to develop messaging for the various audiences we serve: families, business owners, English only, Spanish only, and bilingual people. Then we worked to recruit credible spokespeople, local authorities, community members, and medical leaders. And then we began development of materials in print, video, audio, electronic billboards, and social messaging. The idea was to have our messages be plain language, very local, and relatable, and to do publishing both in traditional and social media. Now we'll discuss how we identified health literacy opportunities to reduce vaccine hesitancy. In talking to our target population and even some of the employees of the Regional Center for Border Health, we identified a series of myths about vaccines that cause hesitancy. And many of these myths have also been identified by literature during the beginning of the pandemic. One of the myths was that getting a vaccine is too difficult and is too expensive. Another is that the COVID-19 vaccine is not safe because it was rapidly developed and tested. Still another was, I already had COVID-19 and I have recovered, so I don't need to get a COVID-19 vaccine when it's available. So the idea of natural immunity. Another myth was that there are severe side effects of the COVID-19 vaccines, and another that the COVID-19 vaccines don't work because you can still get COVID after vaccination. Then later, a myth emerged that the current COVID-19 vaccines don't protect against the COVID-19 variants. And many people thought that children can't get severely sick with COVID-19, so they don't need a COVID-19 vaccine. There were even some conspiracy theory myths that said something along the lines of the COVID-19 vaccine was developed to control the general population either through microchip tracking or nanotransducers in our brain. Some people thought that COVID-19 vaccines will alter my DNA. Others believed the myth that COVID-19 vaccines were manufactured using fetal tissue, and still others that the COVID-19 vaccines would cause infertility or miscarriage. It was a prevalent myth that pregnant and breastfeeding women should not get the COVID-19 vaccine. And then there was the myth that people would not need to wear a mask after they get vaccinated for COVID-19. We realized that not everyone believes all the myths and that not all the audiences consume information in the same way. So we needed to evaluate how to bring our messages that would combat the myths, how to bring those messages out to the public. So we broke it down into individuals and families, business owners, young adults and teens, and then some overall messages for all audiences. For individuals and families, they needed the message in English or Spanish or both, because in Western Arizona, as we've mentioned, the population is highly Hispanic and very often Spanish preference. For them, we did TV and radio ad rotations in both languages. For business owners, we added electronic billboards that talked about the health of the business in addition to the health of the families. For young adults and teens, we put out some social media messages on a regular schedule to drive them to our educational videos. And for all audiences, we developed an educational website, which is bilingual. We developed videos and put them on a RCBH YouTube channel, and then, as needed, flyers and other materials. The essence of the Vaccine Confidence campaign focused on two areas. One is keeping families healthy, with the message La familia vacunada vive mejor, the vaccinated family lives better. And it was covered on the bilingual interlinked informational website familiasvacunadas.org. The other message is the importance of keeping our businesses open, keeping our workers and our customers safe. And the message was, help us to keep our doors open. Also on the bilingual interlinked informational website under the name keepourdoorsOpen.org. We then put a series of videos on the YouTube channel with family-oriented video message and business-oriented video messages. And here's the link to that YouTube channel. To combat the myths, we brought together a group of spokespeople, some nationally and locally recognized physicians, some employees of the Regional Center for Border Health, some promotores and promotoras, that is, lay health workers, and community members. The messages were clear and concise education in plain language. And we had TV and radio campaign with a rotation of messages, outdoor electronic billboards along rural highways, and social media messages guiding viewers to click on the informational website and video messages on the RCBH YouTube channel. To combat the myth that it's difficult or complicated and expensive to get a vaccination, we did this video, which we'll see in a moment, called Vaccinating at San Luis and Parker Walk-in Clinics is as easy as 1, 2, 3. It was a simple explanation of our drive-through vaccination process, and it reminded people to please wear a mask and bring their insurance card and ID documents to get vaccinated.
This is a 3-step process for our drive-through vaccination. The first step is getting your demographic form, making sure that you have the correct form. From there, you go to our second step. One of our trained promotoras explains to you exactly what needs to be filled out, if it's either your first dose or your second dose. That way, when you get to the third step, we can give you the correct vaccine and make sure that everything is correct and that you're the correct patient. From there, we're going to vaccinate you based off of the vaccine that you want. Once we give you the vaccine, we'll explain to you any secondary effects that you might have. Once getting home, what you can take in case you do end up having like any symptoms of a fever, chills, or runny nose. Once you are clear and your 15 minutes have passed, we'll let you know when is your next vaccine and wait for you to come back.
So for us, we haven't stopped yet. All our drive-through stations are open on a daily basis, and our urgent care centers are also open all the way through the weekends, providing testing and drive-through testing.
At San Luis Walk-in Clinic, we're vaccinating everyone 5 years and older. For more information, call the Regional Center for Border Health at 866-604-5537. KeepOurDoorsOpen.org.
We have multiple videos on the family focus, both in English and in Spanish, and here we'll show you one of the videos in Spanish. These are health literate messages in both Spanish and English that resonate with parents and caregivers about protecting their health and keeping their families safe from COVID-19. This one is called Para proteger a nuestros hijos menores de 12 años ante el COVID-19. Let's see the video.
La forma más efectiva en que podemos proteger a nuestros hijos menores de 12 años ante el COVID es cuando nos vacunamos todos, mamás, papás y hermanos mayores. Recupera la confianza para hacer las cosas que le gustan a tu familia, porque la familia vacunada vive mejor. En San Luis Walk-in Clinic vacunamos a todos los mayores de 5 años de edad. Para más detalles, llame al Regional Center for Border Health, familiasvacunadas.org.
For the business focus, we put out plain language messages that resonate with business owners about keeping workers safe from COVID-19 in order to keep their businesses open. This one is called Protected Workers Means Stronger Businesses. Let's watch the video.
Protected workers mean stronger businesses.
We're all vaccinated already.
When you visit our business, we are taking steps to protect you. Please protect us as well. Get vaccinated and help us keep our businesses open and our community healthy. At San Luis Walk-In Clinic, we're vaccinating everyone 5 years and older. For more information, call the Regional Center for Border Health at 866-604-5537. It's your turn, Arizona.
Among many of the health-related myths about the vaccine, we wanted to address the natural immunity myth. And for this and several other videos, we enlisted the help of Dr. Alfredo Quiñones Hinojosa, who's a world-renowned neurosurgeon at Mayo Clinic. And he did this video on what happens with those who decide to leave COVID-19 protection to natural immunity or to chance. One thing that's very interesting about Dr. Alfredo Quiñones is that he is originally from the border area that we serve at RCBH. He originally started out as a young man as an agricultural worker and eventually went to college and became a very, very important physician. So let's watch the video.
Some people believe that they can create their own immunity, accepting that they will get sick and thinking that getting the illness will give them the antibodies that will protect them later. Unfortunately, COVID diseases can be much more severe and cause long-term complications, and it is not worth taking the risk by not getting vaccinated. The World Health Organization has said that not getting vaccinated is one of the biggest health threats around the world.
In this video, we wanted to show a message from community leaders, local elected officials, local mayors, community members, business leaders, and both young people and adults, that the message is we're all vaccinated already. Let's watch the video.
I already got it back. Our families are much safer now against COVID. I already took the shot.
Let's keep our businesses open.
In San Luis, we're more protected against COVID.
As a birthday gift in January, I got vaccinated. I'm 14 years old and I already got my first shot.
We are 4 and we're all vaccinated.
I've already vaccinated myself and my family. It's 5 of us.
We have done so much to protect our community against COVID-19. Take care of yourself.
It's your turn.
It's your turn, Arizona.
Please get vaccinated.
At San Luis Walk-In Clinic, we're vaccinating everyone 5 years and older. For more information, call the Regional Center for Border Health at 866-604-5537. Keep our doors open.org.
After we published the initial communication, awareness, and education videos, we did continuous updates to the campaign as conditions and recommendations changed. For example, here are some of the materials that we did on booster shots, both in English and in Spanish. If you received your shot 4 months ago, you can now get your booster. And in Spanish, pasaron 4 meses desde su última vacuna o refuerzo, es tiempo de su booster. Many people and organizations in Arizona worked to increase confidence in vaccinations and to increase vaccination in general. RCBH was certainly one of the leaders through its San Luis Walk-In clinics and through partnerships with many other organizations. So while our program wasn't the only one in Arizona, we believe it contributed to increasing vaccinations for the population. And here's an example of the vaccinations in Yuma County as of April 30th of this year. The total number of people vaccinated was close to 90% with 1 dose and above 70% with 2 doses. The adult population was 95% with one dose and over 80% fully vaccinated. And finally, the population above 65 years of age was also 95% with one dose and 77% fully vaccinated. And with the boosters, we found that in the total population, 38.5% had gotten their booster. And above 65 years, it was 60 or more than 60% who got their boosters. So while this effort continues, it seems to have had a very good effect in Arizona. The other two counties did not grow as much in vaccination as Yuma County did, but they are on their way and growing, and we feel very thankful and appreciative for the population to be getting their vaccinations. So as a session summary, for communication, education, and vaccination, we described the design and development of a bilingual, comprehensive, integrated communication program following the best practices of health literacy to increase vaccine confidence, accessibility, and uptake for the community, the service area, and RCBH's patient population. And we focused on addressing the obstacles that people have told us interfere with getting vaccinated, including myths and misunderstandings about COVID-19 vaccination. We applied plain language principles of health literacy to raise awareness and educate about the importance of vaccination. And since many of the community members get their information from television, radio, and social media, we designed video, broadcast, and social messages. The materials, as I said earlier, are centralized on a YouTube channel, and we built an informational website in both English and Spanish with social media messages that drive community members to that website and the YouTube channel. And finally, the activities of the project included to increase health literacy and to amplify the health messages. In terms of increasing health literacy, we included educating clinic, public health, and EMS teams on the importance of appropriate vaccinations, including but not limited to COVID-19 and other infectious diseases. And on amplifying the health messages, we worked to engage public health, businesses, school districts, faith-based organizations, and others to create a community culture of sustainable, equitable, and inclusive vaccine confidence and strengthen the capacity for fact-based community conversations. Thank you once again for viewing this pre-recorded session. We hope it has been useful to you. And if you have questions, you can ask them via the discussion and Q&A box or send us an email directly either to myself at bennett.consult@outlook.com or to Mr. Hari Camino at hari@satya.mx. We look forward to the rest of the conference, and thank you again for your attention.